In today's Daily Health, there's growing concern over a rise in severe Strep A infections in kids. Several children's hospitals reporting a higher than average number of cases this season, and that's having an impact on hospitals already overwhelmed with respiratory infections, including flu and COVID. NBC News health reporter Aria Bendix is joining us now. She's been looking into this. So, Aria, doctors are calling this particular illness that we're seeing now invasive group A strep, right? How is that different from the strep we typically think of?
Yeah, so it's an important question, an important distinction. So ordinary strep and invasive strep are caused by the same bacteria, but they can have very different outcomes. So with ordinary strep, you think strep throat, sore throat, potentially some rashes like scarlet fever, which tend to be pretty mild. Yeah. With invasive strep, it's more life-threatening, and these cases are often leading to hospitalization or ICU admission. So you're seeing some of these lower airway infections like pneumonia as a result of these infections. You're also seeing some skin conditions that can be pretty aggressive, like necrotizing fasciitis, which is this flesh-eating disease. Yeah. So really scary. Thankfully, ordinary strep is pretty common. We're seeing several million cases a year, but invasive strep is pretty rare. So about 14,000 to 25,000 annual cases.
So we've been looking at some of the numbers, right? Texas Children's Hospital in Houston, the biggest children's pediatric hospital in the country, recorded about 60 probable cases. That was in October and November. So what do we know about what's behind this rise in infections we're seeing around the country?
Yeah, I mean, I should start by saying we don't know for sure what's causing it. Yeah. We have some theories. The CDC thinks it's related to this respiratory virus surge. So sometimes when someone gets COVID or RSV or influenza, they can also get a secondary bacterial infection.
Up to other stuff.
Yeah, like Strep A. So that's why we might be seeing it, particularly among kids. Kids, obviously, are particularly vulnerable to these respiratory infections. And we did actually get confirmation today that we've seen 2 deaths in Colorado, 2 pediatric deaths due to these invasive infections, both among kids who were younger than school age.
So, which is scary for parents, right? What do they do at this point if they're concerned, they want to try to prevent this from being an issue? What do parents do?
I mean, for most people, hopefully it won't be an issue, but if you're looking for some early signs, obviously if your kid is having what's worse than a cold and it's lasting for a couple days, you might want to take them to see the doctor. If they are dehydrated, if they're unable to urinate, unable to eat or drink properly, lethargic, you might want to seek emergency medical attention. And they can get antibiotics like penicillin, which are really, really effective, and those are better if you administer them earlier.
Yeah. Don't wait to go to the doctor. Some good advice. Aria Bendix, we appreciate it. Thanks.
Thanks.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.